Welcome back. As South Africa marks Mental Health Awareness Month, this year's focus is on access and inclusion. There are also urgent calls to strengthen community-based mental health care. The Professional Board for Psychology says this year's campaign is about turning awareness into action. Its Vice Chairperson, Professor Ramadungwane Tabane, joining us now to discuss this further. Professor, very good morning to you. Thanks so much for your time. And yes, like we say there, we've adopted the theme here in South Africa. There are several, but ours is access and inclusion, why community mental health is important. Globally, the theme is turn awareness into action. Both of these are telling me, or suggesting that so far, as much as we focused on mental health, we've been mostly all talk and very little action. Do you agree?
Indeed, the no action comes because of the access that we are all asking and we are all espousing for. Mental health, it's a human rights matter. It's a health matter. It's not a standalone. And for it to be realized as well, we need that access, and that access comes as well with the creation and having enough manpower. So the slow action that you are referring to and we are all highlighting, it is because we are not having enough mental health practitioners.
When you speak of access, Prof, I mean, exactly what is needed? What are the resources that we are lacking? Where are the gaps? And I would imagine that this stretches as far as, obviously, those who cannot afford to see a psychologist or a psychiatrist because of pricing and access, like you say, and finding them nearby.
Yes. First and foremost, the availability of the mental health practitioners is very sparse, with the main congregation in Gauteng. That's first and foremost. Are not enough. Secondly, the fees are also not palatable, so to say, to the poorest of the poor. It will set you around 1,000, between 1,005, 1,008 for only a session with a mental health practitioner. The people in the rural areas cannot afford that. Hence, we're always constantly asking for the community and to be in touch with free services given by people like South African Depression. But for that to happen as well, you need to have money to be able to make a call. You need to have money to be able to get to the data.
Yeah, and it's not just a matter of going out for one day and having a chat with someone. This is a process. It has to be ongoing. And I'm going to pick up about where you spoke about rural areas. And, you know, we have different cultures. We have different people who have different beliefs in this country as well, especially in those areas. Mental health is often mistaken for, let's say, witchcraft or demon possession. And those are the kinds of things we actually need to start addressing as well in those parts of the country.
Yes, for a medical condition of any sort, psychological condition of any sort, or any other social, it needs to be understood in the context that it is presented, as well as what is scientific. Scientific does not necessarily mean Western, in terms of the proven evidence of attending and dealing with it, and both. The traditional and the allopathic, once they start to communicate and say, but what do we know about such a condition? How do we sensitize and how do we teach, reteach, train and retrain each other in order to deal with the symptoms that we see? What do we know from dealing with it? How have you dealt with it before in your own space, and how are we dealing with it in this particular space? At the end of the day, the key here is about health. And if a person believes in witchcraft, as you have indicated, they believe that it might be a religious thing. At the end, we need to say, but that's fine. How do we then get together to understand it so that it can be attended to and dealt with in a manner that, firstly, we do not harm anyone, it will not put anyone in jeopardy, and it will indeed deal with the conditions and the symptoms that are presented.
And you're absolutely right. There needs to be that connection between the professionals who deal with this and traditional leaders or healers as well. There needs to be buy-in from there. Prof, we've been going on about the workplace for the past couple of years, talking about that being one of the main places where health and awareness, health and mental health awareness actually need to become more of a priority. Are we actually doing that? Are we seeing employers actually really worried about the mental health of their workers?
Of employers in matters of mental health. We see them in taking a centerfold in meetings. We've seen them taking centerfold in activities within employment sector. However, it's not much is done because of issues around stigma, for instance, where it is the people around. The systems are there, but the people around in the usage or the accessing tend to neglect or tend to talk a negative to the mental health matter, where a person might have depression, the person is afraid of divulging, the line manager fear that it can be used against them, bipolar, fear that the fellow employees might use it against you. But we've seen that right now, medical aids in connection with the employers are communicating, and actually most of the employers do offer the medical aid services, which is unfortunate that, as you spoke earlier on, that people in the rural areas don't have access to that. And there's also issues of certain limitation where it seems as if medical aids do not pay for certain mental health conditions, which is unfortunate.
Yeah, it is very unfortunate and like you say, very, very pricey. So where do we start, Prof? Where do we start to actually get the buy-in, like you say, get rid of the stigma, which has been a battle, I think, for decades already, and to close the gaps that we are seeing? Do we take this, dial it back to school, maybe primary school even, where children are taught now it's okay to go and tell somebody or trust this person to tell them what is wrong with you or what is wrong with your life or how you're feeling?
You know, our biggest ally is the teachers, life orientation teachers. Well, there's been talk about life orientation here and there. Those are the people with the training, or should have the training, of basic psychology, basic counseling, for them to be able to start to sensitize the population that are going to be the leaders of the future, to say there is nothing wrong with communicating how you feel. There is nothing wrong with communicating the condition that you might be going through. Making conversations around mental health not a secret. You know, I want to talk to you about something, and you pull somebody on the side. Actually, I think I'm depressed. No, let's talk about it the same way as we're talking about I have a headache. Do you remember times where people were shying conversations around cancer? We're shying conversations about around men performance in a certain room. Those things were action was given and intention was put to say, we need to talk about this. We need to put it on the table. It needs to be part of the conversations every day. Men,
yes,
when they're sitting together, they need to talk and say, look, I'm not coping here. What are you doing for your situation, for you to be able to be seen to be prospering? Ladies and children and everybody, they need to start to have a conversation, and it needs to be a normal part of the daily life.
Yeah, and I absolutely feel that we need to be having more of these conversations. Prof, just to wrap it up, we are out of time, but just to sneak in a quick one there. I mean, like you say, women can speak to other women. They talk to someone. Men find it, look at it as a sign of weakness. So what is the next generation going to look like? What are they going to be going through if we don't start to fix that attitude or how we think about mental health right now?
childhood adverse conditions that were left unattended and led to this spiraling post-traumatic stress disorder. The same is happening, where now people, because they are not given platform, or they are not taking the platform that is there because of that stigma, are going to continuously be re-traumatized because of these hidden conversations and hidden messages that are not there. So unless we start to attend and intentionally so speak to the issues of health, and those issues of health include mental health, because mental health is a human right. It's a health.
All right, absolutely. I think we've lost you there, but thanks very much for that, making those very important points. And true, Professor Ramadungwane Tabane, Vice Chairperson for the Professional Board for Psychology. It is time to stop talking and start acting. A look at your sport now. The Springboks survived a tough battle with Argentina to walk away with the Rugby Championship title. They retained their crown with a narrow 29-27 win at Twickenham in London. Captain Siya Kolisi has praised his team.
Part of our boys. It's not the perfect game of rugby that we played, but the fight that we show each and every single time, you know, it doesn't always go the way we want it to go, but we always are able to find second gear. And it tells you also with the bench that we have, you know, there's not